Mental Health Monday
on Radio City Talk
with Mick Coyle.
Tackling the stigma.
Radio City Talk.
There is a video online now at Radio City Talk on Twitter. If you want to listen again to the this week's Mental Health Monday, we were talking about Sean's place on the programme, and Debbie was our guest in the studio. There's a video there and a link to the Listen Again show as well. If you want to share that through social media, that would be absolutely perfect for us. And if you want to support the show, you can drop me an email, mick@radiocity.co.uk, or get involved in Mental Health Monday. We want to hear from you, mick@radiocity.co.uk. Now, Debbie mentioned on the programme yesterday the Hub of Hope, which we plug a lot and talk about a lot, and obviously Jake Mills comes on the programme from Chasing the Stigma, the man who set up the Hub of Hope, and there was a bittersweet moment within this week's show. Jake, you'll have heard it yourself, where Debbie was looking to try and find organisations that may have helped her brother, and for whatever reason, various different reasons, she couldn't find those organisations, and it was only after he died, unfortunately by suicide, that people said to her, why didn't you try this? Did you speak to these people? Did you go on the Hub of Hope? Which, by the way, is no failure on your part in terms of getting a message out. If anything, it's about, this is a brilliant resource here. This database can give people an opportunity. And I guess you hearing that would have thought, great that it's been found now, and she can spread that message, we can spread that message, you can spread that message. But clearly that need for it is there.
It is. I think you said it there in that bittersweet, in that, it's obviously nice to hear that it could have been useful, and that Debbie is finding it now and being able to help other people and the people that they're seeing. But of course, it was too late for Sean, and that's, Sean, unfortunately, will fall into that category of people who have died by suicide without getting that help and support. And that's kind of exactly why we exist. We travel the country talking about the Hub of Hope and promoting it in the way that we do. And I often hear people say, I've never heard of it. And I can't blame people for never hearing of it, because we have had no money to be able to promote it and to market it. But despite that, we've been able to have more than 80,000 unique users across the country use it, purely because people are desperate for one central place to go to find the help and support. In 2017, all the people who died by suicide, 74% of those who died by suicide were not known to mental health services or had not been seen in more than a year previous to their death. 74%, 3/4 of people dying without getting any help. So we know there's a significant problem there. And I suppose kind of what we've been trying to do over the last 2.5 years of the Hub of Hope, it was launched in July 2017, is prove that concept. That's what we're trying to do. We're trying to prove the concept, because the Hub of Hope is not funded by anybody. We're up until next week a team of one trying to work on this. We're not bringing in any major investment. We're not working with kind of these funding streams or nothing like that. We're literally one person trying to prove a concept, and I do think that we have proven that now. The Hub of Hope, NHS have said that improving digital pathways is one of their priorities as part of the long-term plan, and they've acknowledged that the Hub of Hope is the best current example of doing that. So we have proven that what we want to do is useful for people, and I can't say that I'm surprised by that, because it's a really simple thing. Why doesn't it already exist? One central database for all mental health support. But now we have proven that, and we're able to hopefully bring in some investment, bring in some money, and build on it, and importantly market it, because we don't want people to be in a position that Debbie's found herself in, where she's found it just that little bit too late, because so many other people find themselves in that position as well.
So often we talk about parity of esteem between mental and physical health, but actually, in cases there, in Sean's case there, if this had been a physical health thing, if it had been, a leg break or a cancer, he'd have been in those systems, he'd have been through that system, and he'd have been on a pathway to, finding a solution to that physical case. But as Debbie set out, he was in the system, the mental health system, but the treatments that he was receiving and the conversations that he was having weren't quite scratching the itch that he had in his own mind. And actually the solution wasn't, it would appear, coming from a medical professional. The solution that they were looking for, that the family were looking for, was more around that sort of social space, that social environment, which is why sometimes when we talk about mental and physical health being the same, or we compare the two, there are also differences and specifics around this. And actually that was a specific example, was it not? That actually, from a mental health point of view, those sort of organisations that are involved in the arts, that are involved in, sport, that are involved in, just social cafe sort of environment stuff, have a really crucial role to play in this. That might actually be the key to someone really moving forward in their lives, if they've been in the system or not.
Absolutely, I think they are the key. I think it's communities who hold the key. It's organisations like what Sean's Place is going to be, and the hundreds of services that you've had on here, who people have created because they've seen that gap. I think you've raised a couple of points there that I think the current system thresholds are so high, waiting lists are so high, that the current system does work in a way where it's kind of, you have to meet certain criteria, certain thresholds, and if you don't, then it's kind of thank you, but move on. And that's because of the pressure that they're under. Also,
come back when you're worse.
Yeah, exactly that. And then also you're getting this one-size-fits-all type of approach that is not appropriate to everybody. Also, the point that you just made about physical and mental health, I'd say the biggest difference between being physically unwell and being mentally unwell is that we now understand the process to get better. Even with our physical health, we feel like we know our bodies well enough to know if something's not right. If something's hurting or something's not feeling right, we know our bodies enough to question it, to go to a doctor, to explain, even if we don't know how to, explain how we're feeling, take what they suggest, try it. If it doesn't work, challenge it, go back. I know at the point where we go, I think I might have to go to the hospital, I think it might be an emergency. With our mental health, we don't know that. We don't even know the beginning of that. We don't know the signs and symptoms to look out for. We don't know how we will feel and how we can go and get that help and support, the stigma that's attached, preventing us from asking. So there's loads of different complex layers to this. But also one of the biggest kind of contributing things for that is because we're not taught about it, and because we're not taught about the signs and the symptoms and the feelings that we'll feel, it leads to that feeling of isolation, that nobody else feels the way that we do. Whatever you're going through, nobody else can understand this, so I can't talk about it. That's why when you're talking about having that interaction with people, sometimes just having somebody else go, yeah, I feel exactly the same way. I feel exactly the way that you've just described, or suddenly I can use my words to describe something and suddenly you can go, actually, I didn't realise I was feeling that, now I do. Those interactions, I think we have to be very careful when we're telling people to share things publicly, but those reactions that we can have and interactions in groups like that actually can help you work out how you're actually feeling. And sometimes it can just take that interaction to know that you're not alone, to go, I can actually deal with this. I don't have to go to a service, as long as I know that there's a support network there of people who do understand.
But I think that's the thing around and again, the word stigma comes around all the time. If you're thinking a certain way and you're thinking that that's the wrong thing to be thinking, and you shouldn't feel like that, and you shouldn't have those thoughts, and you shouldn't feel like yourself about that, you shouldn't feel about people around you like that. But then if a lot of people go, oh yeah, I feel like that too, then suddenly that stigma evaporates, doesn't it? Mm-hmm. Your mental health improves instantly because you're thinking, oh, even though I may be having these thoughts and these issues, it's actually quite a normal thing to happen. And I think when you so many times you hear, don't you, of one problem leads on to another problem, which leads on to another problem. But that stigma is the creator of problems, isn't it? Mm-hmm. Because it's the thing that stops the conversation. I was minded to the fact that Debbie was really keen to say that when people go into, Sean's Place in the sessions that they've had, they make sure that they've got the branded outfit on so that it's not just we'll open the door and see some people come. They had the branded outfit on. They also had sort of the backstory to each individual person as well, so that there was a credibility to those individuals, even though they weren't, medical professionals in any way, shape or form. But they were saying, well, look, I'll have a chat with you and this is my experience, and that will hopefully allow you to be open to discussing your experience.
Yeah, I think there is a difference between saying, I know exactly how you feel, and I everyone's different. Yeah. We'll all have our own experiences of it, even if it's of the same type of thing. It'll all be individual. But I think Debbie made a point yesterday where she said that one of the people who attended was saying, you won't understand, you don't understand. And then suddenly when there's actually that personal story connected to it, it's like, oh, okay, you do understand. And maybe you don't understand my situation exactly, but there's certain things that we can relate to. And that's why it is important to try and to humanise and normalise. And in my honest opinion, getting away from this clinical side of things, to say to people, you don't have to be experts and qualified in order to have a conversation. You can have a conversation that can then be the gateway to getting somebody to those who are experienced or qualified to actually help and counsel that person in whatever way, shape or form. But actually social isolation is one of the biggest contributing factors, and that isolation can come as a sense of nobody understands how I'm currently feeling.
I think they call it social prescribing, don't they? Where you're not put into a medical environment, you're put into a different type of environment, and it might not work for you in one case, but then the next thing might come up as well. Have you had a look as to whether or not that can be built into sort of the medical system, so that when you get a knockback, when you get a no there's no appointments available, no there's no counsellors available, no you're on a waiting list for the next 18 months, but here's the social prescription, or here's a social prescription service in your area, which means you might go to one of these sessions which are, group work, that are art, that are men in sheds, that are, all those different things. Yeah,
I mean, it's been talked about by government as something that they do want to look into and invest in and actually make a working model for. And it's happening in different parts of the country. It's happening here, and Mick Coyle looking at how they can introduce that. But that is the way that it needs to go. And in my opinion, it's not one or the other. It's not saying, well, you are on a waiting list, so you can't then go to somewhere else. Or they all should work hand in hand, because actually you might get medication, be put on a waiting list for somewhere, but then through social prescribing saying is somewhere where you can go, you might not need to go to that support. So that will relieve that pressure on the NHS, and it's essentially what the Hub of Hope is. It's looking at those other social networks that you have to be able to tap into support that might be right for you.
I got an email through this week. I'm not going to mention the name on it, but I'm just going to give it a quick mention just in terms of the details contained within. I'm 16 years old and I'm currently in the city of Liverpool College. My ambition is to kickstart a campaign surrounding mental health, named Mental Health Needs Wealth, to raise money for Broad Oak Mental Health Unit in Liverpool. I feel as though a lot of people recently are talking about mental health, which is amazing, but me and many others feel as though people not actually doing anything to break the stigma surrounding it, especially when it comes to men. They go on to describe some of those stats that you're well versed in regard to the threat of negative mental health to men. Do you not agree that if we all work together, we could just stop the number of suicides in the UK from increasing and stop the amount of vulnerable people, sons, fathers, mothers and sisters from ending their own lives? Can you help me get my campaign up and running? Can you help prevent another death? My dad was a patient in Broad Oak Unit and suffers from PTSD, paranoid psychosis and depression, and so I've watched him suffer for years in silence because of the stigma. Please, if you can do anything to help me with the campaign, get in contact, and hopefully we can do something. It would mean so much to me and my dad. We can do something there, can't we?
We'll get behind that one. I think the point that was kind of raised in that is that it's not about necessarily just about awareness. It's actually about resources and helping organisations and charities and resources actually be able to survive, because awareness is great at the moment, but actually it's about the services and letting people know where to go. That's more important.
Absolutely. So I'm hoping that email which has been forwarded on to me has got a contact detail that we can fire back. Otherwise, get in contact with us here at the station, and we'll do our best to help you out and raise some awareness. Maybe that'll be a future edition of Mental Health Monday. I know you're only young, but we'll sort things out through adults and so on and so forth to make sure we can have that conversation. Mick@radiocity.co.uk is my email address. That's mick@radiocity.co.uk. Now, Jake, we were both due in London tomorrow. You've cancelled because you had a parliamentary thing, but because there's a general election, there's no parliamentary thing now because there's no parliament. Yeah. Because it's been dissolved. So main producer John are going to go to the My Media Awards.
Yeah. Are you going to bring it back? Have you got your lucky tie?
It's me lucky scarf.
That's it.
You know what? That's a thought, that, because I was thinking the other day, what's the weather like in London at the moment? It's always about 15 degrees warmer than it is here. Might be all right, but throw the scarf on.
Take it, just sweat in it if you've got to.
Yeah, we'll see. So we're nominated for Radio Programme of the Year. Now, we won that last year.
Yeah. But
hard to win things 2 years on the bounce.
No, but I did say it at the time when we won it last year. It's not just a show. You're up as well.
Yeah.
And, you know, these are National Mind Media Awards. Are a big deal. The national awards in the South Bank Centre. These are big things. And actually, you and the show have been nominated for the last 3-4 years. 3 years?
Yeah, 3.
I mean, I think
we're doing all right, yeah.
Don't take that for granted, because that's a big deal. That is a big deal, and you deserve to win both awards.
I have been told, though, by some people, though, who hear that we do mental health, and they almost think, we can't do mental health because you do it, or people will think you're nicking it. Nick the idea. It's fine.
Yeah. No, it's fine.
Nick it. Have it.
Yeah.
You know, I'm going to carry on doing it. If you do it as well, fine.
Yeah.
You
you don't sound that far about it.
But if you win a load of awards, then, fine, there might have been awards that we could have entered. But, like...
I know the point you're trying to make, but it's not coming across, really.
Is it not?
No, you sound like, fine, whatever.
But, like... I genuinely think, though, that like we do it here, and we got mentioned in the suicide prevention strategy health select committee. Yeah. We got mentioned, and I thought that's great that we've been mentioned, but that was one radio station in the country that gets mentioned. But if you talk about the normalisation of it, and of course different national stations might have themes and weeks and months and stuff. But if you just throw it into your everyday conversation,
exactly.
Hopefully people will have heard the show over 135 episodes as it is now, and just gone, well, I can remember 2 or 3 of them, or I might remember part of the 24-hour show, I might remember the shoes. But that just might be the start of that conversation that they need in 3, 4, 5 years' time, which they go, actually, that stuff you're saying doesn't seem that normal, because they talk about it on the radio every single week.
Exactly, twice a week.
Yeah. And also Jake Mills is there.
Yeah, but it is, it's you're just having his part of the show now. That's just it. And that probably wasn't an easy thing. I don't. Maybe it was to try and get across at the beginning.
Well, it's. I mean,
but it is.
Have you? I mean, and your story's been well told on this station, but you've been right, to the brink when it comes to your own mental health. I don't feel awkward now talking to you about mental health, and I get the sense that you're comfortable with me.
Yeah.
I don't feel like I'm thinking, am I allowed to ask these sorts of questions? Am I allowed to talk about feelings? When Debbie came in, she came in knowing that the conversation was going to be about a really difficult thing, because it was about, a brother's death. So, of course, absolutely, there's an understanding that goes with that. But if I'd have been going, are you allowed to? It's about creating an environment where we go, look, if you're comfortable to talk, we're comfortable to listen. We've got an audience there who are educating themselves in regard to all of this, who are choosing to be part of the show as well. And if you talk, they'll listen, and I'm absolutely certain that they'll understand and also respond.
Yeah, but you're talking about but you've got to give yourself credit. I don't know who you're up against tomorrow in terms of the journalist award.
I didn't check in case it was someone really good.
I don't think anyone's doing as much as what you're doing. This has been over a number of years now, and yes, you're able to have those conversations, but you've done that yourself, and you're guiding these conversations, which can be really, really difficult for people. So I really, really hope that you win it. I really do, because I think you really, really deserve it. So good luck.
I ain't going to say anything more after that. Jake Mills, thank you for your time. mick@radiocity.co.uk. You want to get involved in the show.
Mental Health Monday with Mick Coyle.
Radio City Talk.